I think CBTF has done such an amazing job over the years in helping brain tumor research and developing junior faculty. And it's a real privilege and honor for me to be part of this scientific advisory board. I think the hope is going forwards to help the organization to leverage its resources and focus on the most promising areas of brain tumor research, and also to develop the amazing talent that's available in Australia to help patients with brain tumors. I think the other aspect is together with other members that are outside Australia, hopefully we can connect the researchers within Australia to the larger neuro-oncology community and all work together to advance the treatment of patients with brain tumors. I think brain tumors are such a devastating disease. It's not only a horrible cancer, but it takes away the patient's personality and the ability to function and interact with their loved ones and friends. So I have a driving passion to try to help find better treatments for these patients. I see them every week in clinic. They need to do much better and find better treatments. I think, as many people know, there's been tremendous advances in the use of immunotherapies to treat many cancers, but the same advances have not been seen in brain tumors. And there are many reasons for this, but the tumor has a very immunosuppressive environment, and there are very few T cells, lymphocytes in the tumor to actually fight the tumor. And so we did a study with Tim Cloughesy, who's also on the scientific advisory board, and with Rob Prince at UCLA, trying to understand what these immunotherapies, these checkpoint inhibitors, did in glioblastoma. So we took patients who had recurrent tumors who needed surgery, and we gave half of them the drug pembrolizumab, a PD-1 antibody, before surgery, and another group had no treatment before surgery. And then we took the tumor and evaluated the immune response in the tumor. And then afterwards, everybody got the drug. And we were able to show that the drug actually did increase the immune response against the tumor to some extent. And going forwards, the hope is that we can add drugs to pembrolizumab to augment the anti-tumor immune response. But what was also surprising is that the patients who got the drug before surgery actually did much better in terms of outcome and than the patients who didn't get the drug before surgery, because everybody got it afterwards. And the thought is that maybe there are a few T cells in these tumors that are activated by the drug pembrolizumab. And then if you take away most of the tumor, you take away a lot of the immunosuppressive environment, and these T cells can now become more activated and expand and kill the tumor, and so maybe produce a greater therapeutic benefit. So this is the basis of many studies now using the same paradigm to study immunotherapies for brain tumors. I think even though there has been relatively little progress to date, that I'm incredibly hopeful, because there are so many advances that hopefully are around the corner. There's been tremendous progress in understanding the molecular biology and the immunology of these tumors. And I think the most promising areas of therapy are immunotherapies, combination of vaccines and viral therapies with checkpoint blockade, or even combinations of different checkpoint inhibitors or with targeted drugs. I think another area of promise is that now there are more drugs that are potent, that are developed to cross the blood-brain barrier much better. And so we'll be seeing many of these come into trial. And I think that's a promising area. And then there are also techniques such as focus ultrasound with microbubbles to open up the blood-brain barrier. So this will potentially allow drugs that don't normally get into the tumor to achieve good concentrations in the tumor and have a therapeutic effect. So I think there are many areas of promise, and hopefully soon we'll have much better treatments for patients with brain tumors. Well, I'm terrible because I tend to work way too much. So I work 7 days a week, and my wife is constantly mad at me for that. But I whatever time I have, I try to spend with my family. And I used to play a lot of golf, but I haven't done that for a long time, but I hope to get back to that.